There is something better out there, something more systems oriented to fix your body, because your body's natural state isn't to be in pain. Your
Mhm.
body's natural state is to be out of pain, and pain is just an indicator that something's wrong. Use your body as a teacher.
Welcome to Reps and Redemption, a podcast for moms who want to prioritize their health and build strength from the inside out. Hey there, mama. I know you long to find the joy in all the things homemaking and motherhood while showing your kids that you don't have to give up on yourself, your goals, or your desired quiet time with Jesus just to be a good mom. I'm your host, Ashley Harvey, former college athlete, wife, homeschooling, faith-filled homemaker, mom of 4, nutrition and strength training coach. If you're ready to take control of your health, lose fat, build muscle, and faith, you're in the right place. Grab that iced coffee and let's dive in. There's been a lot of women in the Facebook group that we have with Reps and Redemption that have one of their main topics and concerns that they put in to join the group. I'll say, what's your biggest struggle right now? What is holding you back from your health and fitness goals? And they'll say chronic pain. And whether it's back pain or arthritis related, that's usually what they go to. So before we kind of dive into today's episode, after my technical difficulties, Rick, why don't you introduce yourself and tell everyone where you're at and what you do?
Yeah, my name is Rick Olderman. I'm a physical therapist of over 25 years. I live here in Denver, Colorado. And by accident, I ended up focusing on chronic pain. Um, as a new grad, I was a miserable failure at solving chronic pain. The stuff I was taught in school just wasn't working. I was sunk into a deep depression for years until I realized it wasn't just me who was struggling helping people with chronic pain. It was basically every practitioner out there. And that's when I realized we needed a new approach. And so that's what I've been working on these past 25 years.
That's incredible. I can tell you're in your some sort of studio. I mean, I'm going to be able to see you. So I have that advantage here too. But so where are you at right now? Like where are you? Did you say you were in Denver?
Yes, I'm in Denver. This is my home studio.
Wow. Okay, very interesting. So I what when you say home studio, do you have clients come to your house and work with them there too?
So I used to,
Okay.
and then I purchased a physical therapy clinic about 10 years ago.
Mhm.
And so I shut down this home stuff and focused on my physical therapy clinic for the last 10 years. I sold that a year and a half ago,
Well,
but now I'm competing. Now I'm under a non-compete clause, so I can't treat uh, here for the
gotcha.
next
Okay.
3 years. So now
Okay.
which works out fine with me because I'm trying to reach more people via, my digital home programs or telehealth and things like that. And not, I don't want to be tied to this brick and mortar model because I don't think it really works that well.
Yeah, and I think too, you seem to have that entrepreneurial spirit about you. And I love your model of one to many because there's only so many Ricks, right? But there's
Yeah.
so many people suffering from chronic pain. And I think one of the questions that we were going to discuss and that I was going to ask you is, since back pain is probably the most common type of pain, can you describe how you approach solving that issue, especially in women around the ages between 30 and 40 years old?
Yeah. So to go back to one of your comments earlier, one of the reasons I can go one to many is because over these last 20 years or so, I've realized that problems causing back pain, neck pain, headaches, whatever you want to call it in the body, are due to patterns of problems that are occurring. And most people have common patterns of issues. And what happens is that these patterns manifest in different ways in different people based on their genetics, exercise history, work history, psychological state, all sorts of things. So the same pattern that might cause central back pain in you might cause sciatic pain in another,
Mm.
or SI joint pain in a third, or hip pain in a fourth. It just depends on your unique life that you've led up to this point, how that's manifested in you. So getting to your second part of your question, the reason back pain is one of the most common items on your Facebook group, or, for us in clinics, is because back pain is the most misunderstood problem out there.
Mm.
And so basically, back pain is being caused by a pattern of issues, kind of like what I've talked to about before. And there are two of the most common patterns that I wanted to take you and your listeners through so they can test themselves on this podcast to see whether they have one of these two patterns behind their pain. And would that be okay with you?
Oh yeah, I'm excited because I've heard you do this before, and I'm
Okay.
actually gonna I'm not gonna do it right now, but I'm gonna do it later.
Yeah,
Yeah, go ahead.
especially since you have mothers on here, and we can talk about why mothers specifically might have these problems. But I'll just go into the general pattern first. So everyone at home, I would like you to lie down on your floor with your legs straight. And if you can't get on the floor for one reason or another, lie on your bed or your couch or whatever, but with your legs straight. And please do the test rather than just listening, because if you do the test, then you're going to feel the truth in your body rather than just saying, oh, that makes sense. And then 5 minutes later, you'll forget about what we just talked about. So
Right.
feeling it makes you own it. And
Right, I'm
so
gonna do this. I'm
yeah,
doing
I
it.
think it's pretty important, Ashley.
Yep,
So
the cord is
and
long
then
enough, so here we
yeah,
go.
yeah. And
Okay.
then also, a firm surface is better than a soft surface because it will give you more feedback as to what's happening with your body. So, but whatever
Okay,
you can do,
perfect.
go ahead and do that. So your
I
legs
just
are now
realized this
straight.
cord is very long, so here we
Yeah,
go.
great. So you've been laying on your back, hopefully now for about 30 seconds at least, with
Hmm.
your legs straight. And I want you to feel how your back feels in this situation. And
Mm.
if you'd like, you can go ahead and slide your hand underneath your low back and feel the distance between your low back and the floor. And now what we're going to do is we're going to have you bend your knees so your feet are flat on the floor and feel how your back feels there. And if you
Mm.
don't notice a change in your back pain or discomfort, go ahead and hug your knees to your chest if that feels, like you want to do that instead. So
Mhm.
one of these two positions, either legs straight or legs or knees bent, is going to make your back feel better. Ashley, which one of these positions makes your back feel better?
Definitely knees bent.
Absolutely. 99.9% of the people listening out here will agree with you. All right. So now the second part of this test is important too. So now I'm going to ask you to stand up, Ashley, and all of you listeners out there. Of course,
Okay.
unless you're driving, please don't stand up while you're driving.
I am standing up. Here we go.
Okay. So if you listen to the next minute or two, what you might notice is that the longer that you stand, the more prone you are to your knees locking in a straight position or backwards. And if that
Mm.
hasn't happened with you yet, go ahead and just do that. Lock your knees backwards. And this is an energy conservation move. All right. Now
Wow.
we get to stand on our joints instead of just using our muscles to hold us up. So now feel what your back is doing in this position. And if you're not sure, unlock your knees just a tad and feel what just happened to your back there.
Oh wow.
And if you're not clear about that, then lock your knees one more time. And you'll feel that when you lock your knees, your back is arching more. And you might also notice that when you're locking your knees, you might even feel a contraction in your low back muscles when you're
Oh
doing
wow.
that.
Yeah,
All
I
right.
feel.
Okay, so that's the end of the two tests. So we'll now explain what these are showing us. Well, the first test is showing you that when your legs are straight, your back is more arched, clearly. And it doesn't feel as good as if your knees are bent.
Wow.
Your back is flatter.
Right.
So that's showing you that one of the basic patterns behind your back pain is that, oh, my back is too arched, or that you have too many forces trying to pull it into an arch.
Mm.
And when we bend your legs, we remove many of those forces because your back gets to assume a more natural position. Okay. Now, the second test that we found was that if you stand for more than a minute or two, you tend to lock your knees.
Right.
And then you found out that when you lock your knees, your back is arching more, which is what is causing one of the primary patterns behind your back
Wow.
pain. So, an unconscious habit that you've developed over time
Mm.
is actually contributing to your chronic back pain, and you never even knew that it was happening. So, we're not only locking our knees when we're standing, we're specifically locking our knees when we're walking, because we walk
Mm.
a lot more than we stand. And so anyone who comes into my clinic and also my digital home programs, no one gets away with learning how to walk correctly because this affects everything from the rib cage all the way down to the foot.
Wow.
So
Yeah,
that's one of the basic patterns of back pain.
I felt that too when I did the test that you prescribed here on the
Yeah,
floor. There was a big gap from my like it was quite significant. So what would
absolutely.
that mean for me?
Yeah, well, that confirms, you confirmed right. I don't want people to focus on the shape of their spine. I
Okay.
want them to focus on how their back feels.
Okay.
For instance, if you and I were, if I could reach through this Zoom session and like take my finger and push on your collarbone here,
Hmm.
and you pushed against me, and so neither of us were moving, but we were both generating force, that would hurt, right?
Right.
It would hurt
Yeah.
where I'm touching. I'm generating tension. You're generating tension. Yet there's no change in our positions.
Right.
But if I remove my finger, now your body gets to relax. It hasn't changed its position at all. It's now more relaxed. And so this is basically saying that it's not so much the shape of your spine that matters, it's the tension that it's undergoing that
Mm.
matters. All right. The same with that test on the floor. Yes, you may have a big curved back, with your legs straight, and maybe
Mm.
that is a shape issue, but it's not necessarily the problem. You don't need to walk around and flatten your back. What
Right.
you need to
Okay.
do is remove that finger, right?
Okay.
That's operating on your body, that's causing tension to occur, that's causing that arching tension. Does that make sense?
It does make sense. And when it comes to, I don't know if you've probably heard this in all of your years of experience or seen it, but when I go to the gym and it's chest day, which I only do like once a week when my husband wants to do it, because I don't really want to do it by myself. I'm not a huge bench presser, but when I do bench press, I will bring my feet up to the bench so that my back is straighter, so I can force the bar out. Is there, I don't know if that's like a weird thing or if that's better. What is your opinion on that? Do you think that's, good form?
I think it's good form for your back. And
Okay.
I don't think it's bad form for the chest press either. In fact, if you at that same gym, you've probably watched guys who are trying to push up too much weight, right? And
Right.
what do? They
Yeah.
arch their back,
Yeah, their back is severely
right?
arched. And
And
I'm
so
like,
they're
that can't be
contributing.
good.
Yeah, almost invariably, I bet you a lot of those guys have back pain,
Right.
and their bench pressing technique is one of the things that's contributing to that pattern of extension in their spine, right?
Interesting. Yeah, and I heard of I'm so sorry. I cannot remember his name. It was a podcast with a heavy lifter, and he suggested that if you were going to push that much weight for the sake of your back and to exert more effort to bring your feet up, and that's okay. And I had been doing it for years, so I was like, oh, I'm so glad I've had like a legit gym dude tell me that this was
Yeah,
okay. But that makes sense too. And I did when I released, but when I brought my knees up, like you suggested, that was like that felt amazing. That was
yes,
great. I just wanted to lay there, hugging
yes.
my knees.
And especially mothers, this will
Hmm.
be the case. And it's because they've had children. So this is what I've kind of laid out in my back pain during pregnancy book, is that I had a picture of a woman prior to having her child, getting pregnant. And then I took a picture of her after pregnancy to show that the shape of her back and pelvis did not come back to normal after her
Wow.
pregnancy, even after 6 months.
Wow.
So this is why a lot of women are predisposed to back pain, sciatic pain, and SI joint pain. A, because they're more hypermobile, which we can
Mm.
talk about if you want to, but B, because having a child and carrying a child uh, changes the orientation of your pelvis and back to create more of that arch occurring, and it
Wow.
doesn't bounce back on its own, mostly because you haven't changed the forces that are pulling it into that arch since the
Mm.
pregnancy. All people really focus on is, for instance, if you had back pain during pregnancy, you would say, oh, my back's killing me, and then you have the child and you're just like, oh, back pain's gone.
Mm.
Well, you've just removed about 10 pounds of force that is pulling your back into that arch, right? That doesn't
Right.
mean that there's not more, though.
Right. And I heard too, well, and now I'm 2 months postpartum. So, maybe that's why it felt so good
Yes,
pulling my knees up.
Absolutely.
like that.
Absolutely.
So I'm definitely going to look into that section specifically. What was that section called in your book? You said it before, but can you say it again?
Oh, it's its whole own book. It's called
It's
Back Pain
only,
During Pregnancy.
oh,
So
fantastic.
so I
Okay.
wrote a series of books called the Fixing You series to help people fix themselves. And I've got different books targeting different areas of the body, like back pain or hip or knee or whatever. And so one of those books is called Fixing You, Back Pain During Pregnancy.
Okay,
So
fantastic.
yeah,
I'll make sure to link to that in the show notes as well. So
yeah,
anyone like
but
me is like, "Oh, I want to know more about that."
yeah, you can certainly read it. It's a really short book, but that was written about 12 years ago, and I've updated a lot of that information in my digital home program. So if you want
Okay.
to see specifically about back pain during pregnancy, by all means, get the book if you want. I'm not trying to sell you books or anything like that, but the digital home programs are much more current because those also reflect my clinical when I owned a clinic and trained all my therapists to use this approach to solve pain too. So I got to see a whole. This is when I realized that patterns were happening. Not
Mm.
just that, oh, you've got this particular problem and this person has this particular problem. It's all the same problem. It's just manifesting differently in different people.
So are these, habits that we've kind of taken in over the years? Because if we're talking habits now, those are really hard to break. So what are one or two habits that you see your clients doing that lead to this chronic pain?
Yeah, well, we just covered one of them, right?
Right.
Standing and walking. And we can go over more detail, walking correctly.
Hmm.
But bending over is another big one.
Hmm.
For instance, getting out of a chair, what a lot of people do is they straighten their knees first and then they hinge from their hips to straighten up, arching their back.
Right.
Well, if you do that, then you're setting up a tension pattern of an extension pattern tension to even stand up. All right. So instead, what it should be is if you're going to get up, you want to keep your back rounded because it feels better, right? To
Hmm.
round your back. So keep your
Yes.
back rounded as you squat yourself up. And that will feel so much better for
It
your
does feel
back
better.
than if you just straighten your knees and then hinge yourself up.
Just for those of you that can't see us, I'm listening to Rick because he knows his
Yeah.
stuff. I'm trying to, well, and you said it too with walking and just standing there that we're, and
Yes.
I hear about this with when it comes to pelvic floor issues too, is this something that we really need to pay attention to, and especially as moms. And now it's like, okay, the pelvic floor and now get your back. And it's how do you go about, just being more mindful about when we walk and stand and make it kind of a, because if you're not thinking about it, you're just subconsciously doing it. So
Yeah.
now I don't know if a subconscious habit is really possible to break, but you've seen it happen. So
It is. It takes about 3 days typically.
okay, okay,
And
that's more like a lot less than I thought.
well, what the big teacher is for this is that your pain goes away.
Hmm.
When you have pain, and this is what we did in my clinic, is you know we proved to people, just like we did with these two tests here, we proved to them that this was going to eliminate their pain.
Hmm.
Okay, so now let's say you have pain bending over and standing up. Okay, so now let's do it just like I described. We're going to round your back more and squat up. How's your pain now? Oh, I have no pain. Right. It's that easy. Right. And so they're
Wow.
just like, oh my gosh, you mean all I have to do is unlock my knees or bend over differently? And I would say, yeah, it's not so much the bending over that's the problem. It's coming back up from bending over that's the problem.
Hmm.
Right. And
Yeah.
so, yeah, just change how you're coming up from bending over and start unlocking your knees. And you wouldn't believe, folks, those of you listening, if you start doing this, and probably in the next 2 to 3 days, your back pain will be at least 50% better. It's that simple.
Wow.
And then what that's going to do is set up in your mind, oh my gosh, I've got to keep doing this. So you don't have people like me harassing you. Are you still locking those knees? No, you're not. You're not doing that because you're feeling better. That's meaningful to you,
Mm.
right? And so those two tests show people how meaningful that is.
Wow, that's great. And we were going to talk about two fairly briefly, just, there's neck pain and headaches too that are very common. And the reason I wasn't even going to touch on this, but I don't really get headaches, but I had a really bad headache the other night. And how do you, how would you go about fixing, you can pick both or just one, it's up to you, but like the headache thing, especially with, moms, we're going, going, going. The end of the day, it's like, you know, we're lucky if we have time to do something we've been wanting to do. But, how would we fix that? Does
Yeah,
that have that? I know that falls under the category of chronic pain, right?
sure. Yeah, you could totally fix it. So the problem is people don't understand why it's happening in the first place.
Mm.
So if you've got chronic neck pain or headaches, you've probably been to practitioners who are always working on your neck and your head, especially your
Mm.
suboccipital muscles, right at the base of your skull that meet your neck. And you're getting massages there, or you've gotten x-rays that show all of these problems. But the thing that a lot of people don't understand is, folks, if you're listening at home and you have access to the internet, Google the skeleton, the human body skeleton. And what you'll notice is that our skeleton is comprised of all of these really long bones, right? But there's two areas of the skeleton that don't have long bones. One of them is the pelvis, and we have these big, broad, flat bones here at the pelvis. But we all know intuitively that the pelvis is the center of function for the low back and lower body system.
Mm.
Similarly, the shoulder blade is the other area of our body that has a broad, flat bone. That is the center of function for our upper body, neck, and head system. There are significant muscular connections from the shoulder blade into the neck and the base of the skull. When the shoulder blade isn't working correctly, it causes pain in the neck and the base of the skull via these muscular connections.
Mm.
All right. So, a really easy test, because I love giving easy tests for people to understand really why they're having pain. I've developed this test called the armpit test, right?
Oh, let's
And
do it.
so, what you'll need a helper. But
Okay.
what they'll do is, if you have neck pain or headaches, what you'll do is you're going to turn your head side to side to test whether you're, how far you can turn before you have pain, look up, look down, all that kind of stuff, whatever causes your neck to hurt or headache or anything like that.
Hmm.
Then so you get a bead on that range of motion and the degree of pain that you're having. Then you have someone come in behind you, and they put their hands in your armpits and they
Mm.
lift up their shoulder blades about a half inch to an inch higher than their normal,
Okay.
right? And your job is to relax into their hands as much as you possibly can. Because usually people with chronic neck pain or headaches can't relax the system,
Mm.
right? And so you got to relax into their hands. And once you're able to, and they're going to jiggle your shoulders around a little bit to get you to relax, all right?
Mm.
Once that happens, then you turn your head left, right, up and down again to test your range of motion and pain. I can almost guarantee it will be significantly decreased, hopefully
Wow.
by about 90%. Last week, I had a woman with chronic neck pain for 12 years. It was it was literally 95% reduced in 5 minutes
Wow.
of
That's
us doing
incredible.
of us just testing this. So
Mom, are you
then,
listening?
yeah, then once we understood that it was the shoulder blades that was the source of her neck pain, then we looked into all the reasons why her shoulder blades were having problems, and we fixed those, and you know, easy.
I listened to one of your other shows at the gym the other day, and it was fantastic. And I love what you said about, you know, sometimes we can think that the medical community just wants to shove pills down our throat, but essentially if we keep going back and we're trying the things that they're suggesting to do, but we keep coming back with this pain, that's why we end up with, okay, it's surgery or this or that. And I love the difference though that you said you want to find not just the tiny thing that's causing the problem and treat that. You want to find, like you said, it's the pain of the headache was coming from the shoulder blades and the shoulder area, and how you want to find the actual, not just the symptoms, but the actual
Pause.
yeah, the actual cause of pain. Would you
Yeah.
say that's the main difference between you and maybe another physical therapist?
Yeah, well, you'll never run into any medical practitioner who says that they're not interested in finding the cause of pain,
Hmm.
right? We
Right.
all believe that we're finding the cause of pain. What's different is what is truly the cause of pain,
Right. That's where the differences
right?
lie.
So case in point is, one of my big mentors was Dr. Shirley Sahrman out of Washington University in St. Louis. I took all of her, you know, seminars or read her textbooks and all this kind of stuff. Made a huge difference in my patients when I started implementing her biomechanical information. And I made friends with one of the PTs who was going through that whole series as well. And we ran into each other on the last day. And I said, "Hey, man, how's this stuff working for you?" He's just like, "Eh." I'm just like, "What are you talking about? I'm having like miracles using this information." He's just like, "Yeah, but I'm a manual therapist, so maybe I'll use it for a home program or something." And that's when I realized that our belief systems as medical providers are filtering out information that could be helpful to our patients,
Mm,
because this person believed that he should solve everything with his hands, either by
mm,
manipulating something or massaging something. His patients would never get to see a solution like what you and I just had just now,
wow.
because that's not where he believes he should be,
Mm,
right? This
right.
is exactly why I wrote all my Fixing You series of books over 10 years ago, is because when I realized that, oh my gosh, most of these patients are never going to experience true healing because their practitioners' belief systems are getting in the way, I
Mm.
felt I had to write the books to do an end around the practitioners and show people a new way of solving pain that, that I think is superior.
That's
So,
amazing, Rick.
yeah,
I on the show, I encourage all the women that listen to, obviously, there's a disclaimer at the end of the show too, just to cover all the bases.
sure.
But if you're told a certain way and it's the only way, I beg to differ. So, what other options do you have? And just like you said with your colleague, like he could use the information and make what he does better. And I think that's all we want to do here as moms and women. We just want to live the next day better than the last.
Yes.
And this is what you are teaching is something that we can implement today, which is
Oh, yeah.
incredible. And I love that.
Well, the nice thing, the beauty of the body is that your pain that you have right now is due to a problem that you're having right now.
Mm,
If you solve that problem right now, pain will go away right now.
mm,
Just like this woman with 12 years of neck pain, 95% gone in 5 minutes.
wow.
It didn't take her 10 years to get over 12 years of neck pain,
Mm,
right? I've just seen this often enough that I know that the body will respond immediately when you're doing the right thing.
mm,
And it shouldn't require this return again and again and again for a treatment to fix something. That means that you're not really fixing the problem,
right.
right?
Yeah,
And
the
so,
merry-go-round.
yeah, exactly. So that's basically my take on it is, you know, yeah, no practitioner thinks that they're just like, you know what, I'm just going to treat symptoms today.
Right.
No one says that, right? Just like no doctor is going to say, you know what, I can't wait to prescribe a whole bunch of pain meds to people today, you know? So everyone is thinking that they're trying to help people,
Mm,
but the problem is their information is limited. And our information as medical providers in physical therapy, at least, is based on this component thinking approach to solving pain. So what I mean by that is we learn the names of muscles, ligaments, joints, nerves, bones, all that kind of stuff. And so, and then we are taught treatments to correct strains or sprains or things like that that happen to those things.
mm.
And so we have a million tests in physical therapy to determine exactly which tissue is damaged, right?
Yep.
But we have zero tests that determine why the tissue is damaged. And so this is why a lot of therapists are not helping people with chronic pain, is because of our training in this component thinking as
Mm,
opposed to training in systems thinking.
mm,
Component thinking is great for more acute issues. Systems thinking is what is necessary for chronic pain. It's the lack of systems thinking is why we have chronic pain in the first place,
wow.
I believe.
So, and finding the cause, and then you have the effect that you want.
Correct.
So I really think that this has been truly a super helpful show. And if you have somebody listening right now, and would you just start with those first two steps about the tests that we did? And I can't wait to do the armpit
Yeah.
test with my
Yeah.
spouse because I didn't realize when you were telling me to turn my neck, and I didn't. I didn't know that it kind of hurt. You know what I mean? Like
Yeah.
I wasn't really aware. I think I've been so used to it. So a lot of women who listen to the show, they want to prioritize their health, they want to prioritize their faith, and they want to build muscle so we can save muscle as we age. So what would you tell this woman as she's maybe starting to strength train and starting to work out again? Maybe she took a little break or she's just getting into it. Is there any advice you would give her, to be more mindful of her body? Because, like you said, the body is an amazing, amazing machine, if you will.
Yeah, I think the first message would be to say, especially if you have pain, that you're not broken.
Mm,
It's just that you have not received the right information yet.
mm,
And unfortunately, the wrong information is so pervasive online, in clinics, because of how we're trained,
hmm
and so forth. You can only function on the information you've been given, right? But unfortunately, you have to understand that that information has a bias, and the
Right.
bias is that it's a component approach, whether it's physical therapy, chiropractic, medicine, surgeon, whatever. So I would say, I would echo your words, Ashley, that there is something better out there, something more systems oriented to fix your body, because your body's natural state isn't to be in pain. Your
Mm.
body's natural state is to be out of pain, and pain is just an indicator that something's wrong. Use your body as a teacher, and you will find your answers.
That is fantastic. Okay, so you are not broken if you are experiencing pain, and there is a solution. So we just have to do our own diligence and find it and try to, try our best to solve the problem. I want to thank you, Rick, for giving us your time today. I feel like I could just keep talking to you. I have
Oh,
that
me too.
I like so, if you're ready and willing, I know from this episode alone we're going to have a lot of questions, so I'd love to invite you back on the show officially. We can plan it and I'll make sure my all my technical issues are solved
Yeah.
before we get together again. But can you let everyone know, and I'm going to put all of Rick's information and his online courses and his I don't know how you do your telemedicine, like if that they have to specifically request you. I've heard of this. I haven't done it yet myself, but just let everyone know where they can find you. And I will put everything that you say in the show notes as well, so they don't have to like write it down really quick. So go ahead, Rick. Where can we find you?
The easiest thing is just to go to rickolderman.com, and you can sign up for a private session with me if you want to. But frankly, I have yet to have a private session with someone and not give them everything that's already in my digital home programs.
Wow.
So they're just comprehensive but simple to use. And if your listeners use the code in the discount code friends33, they can get a 33% discount off of their purchase.
Oh,
So
wow. That's
yeah,
amazing.
so
Thank you, Rick.
it's really affordable. And I have a master class. If you're still not sure and you want to hear more about my whole approach, I have a master class on there that's free. You can
Okay.
sign up for and sit through, and I'll do this test and another one or two in there too, to kind of show you and help you see the bigger picture of how you need to be solving these kinds of problems. Yeah, that would be the easiest way.
Awesome. Thank you so much, Rick, for being with us today. And I cannot wait to chat with you again. I'm looking forward to all of the Facebook group members and them listening to this show. And I will chat with you again soon. Thank you so much.
Thank you, Ashley. I really enjoyed talking with you.
If this episode inspired you, will you share with a friend? I would be so grateful if you would leave a podcast review on your listening app of choice. Remember, the content provided in this podcast is for informational and educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please seek the advice of your qualified healthcare provider with any questions you may have regarding a medical or health condition. Remember, be bold, mama, and live well. Until next time.